Hi, this is Dr. A with Intro to U.S. Healthcare, and we're now on Chapter 5 about population health, and this is out of Basics of the U.S. Healthcare System by Nancy Niles. All right, so let's start with what is population health. It is a new, old approach to the system of effective healthcare delivery, Morris and Titmuss created the models of population health during World War II, and then also outlined these concepts of social determinants of health. So it's been around for a while. It just has made a resurgence as we try to reduce healthcare costs, make healthcare more effective and equitable. So this population health movement has really grown. It focuses on the study of health outcomes of designated groups and the influences of their health outcomes by the social determinants of health. So these groups could be geographical. So I'll use this example or a few of these examples throughout the presentation. But for example, Appalachia, that's a geographical area. Or we could go East Coast or West Coast, but we could also do like where I'm located in the Delta of the Mississippi. That is a geographical location. It could be also within a certain state, of course. And it can be by patient type. So, this could vary. The patient type / disease type. I know you're not your disease as a patient, but so you could, for example, target patients with type 2 diabetes because they can get expensive in the healthcare system. But another patient type could be by ethnicity. Maybe there's a disparity between African Americans and whites. For example, in our state, we see a big disparity in infant and maternal and infant mortality. And so that would be something we would want to study in this population, the African American population, what is going on, so that you can designate a population health model to specifically target them because there's a disparity there. All right, so the Institute for Health Improvement has a triple aim. That's their program, triple aim. Their goal is to focus on population health management by improving the individual patient experience. Which then overall increases the health of a community. And that's with each patient encounter and patient interaction. So in the triple aim, you have population health, you have the experience of care within primary care, and then the per capita cost. So they have population health as part of the triple aim and their goal. So what are the activities of population health? So again, they have programs that target a specific population, and then they use different interventions to improve health outcomes. Because of course, if the existing interventions worked or the existing models worked, it wouldn't be a disparity. It wouldn't be a problem, right? So we have to do something different. We have to find out what's going on, and then add an intervention there, and then see if that intervention is effective and actually improves the health outcome. So the social determinants of health are included in this type of analysis. An example of a population health management includes employee health improvements. So this could be, within a large company, a factory, or any large group. Even hospitals have employee health improvements, and this can be things like having free membership to a gym. Some big companies have their own like workouts, gym areas, pools, or whatever, where their employees can go exercise there for free. They get health coaching. They have access to, maybe some interventions that are just for them. They also can do employee health fairs and health screenings, where they check, maybe glucose and cholesterol and their weight and their blood pressure, and they can get incentives for going to the health fair, etc. So examples of the type of care received within population health include, for example, team-based care. And so I have a graph here for team-based care, and they look at Team-based care is, by principle, is family-centered, patient-led, attentive, and flexible to the needs of the patient. And the domains of care within team-based care are coping and support, symptom control, decision-making, which should be collaborative, right, and future planning. So these are just, I just thought that'd be helpful to kind of explain a little bit more what they mean by team-based care. Also coaching to develop healthy skills. So health coaching is an area where population health can use health coaches. And then disease registries that focus on the population health component. And so disease registries track cases, the number of cases of different diseases. There are disease registries for all kinds of different diseases. So an example of a population health management and employee health improvement. So the intervention that they put is a health risk assessment by the company of its employees. And then it is followed by participation in activities such as lifestyle changes, which are then supported by incentives. And some of these incentives could be for just completion of so many weeks of this lifestyle change program. A major component of this type of management is to evaluate whether the interventions improve the employee's health. So there's usually some kind of pre-assessment and post-assessment. And so the health risk assessment can be the pre-assessment. So we are assessing, different metrics, BMI. They can do like sometimes in-body scans where they see like fat mass, muscle mass, etc. They can do, of course, blood pressure, cardiovascular risk, checking with cholesterol, checking for diabetes with glucose. There's, do a lot of the things that are done at health fairs. And an example then of a community-based activity could be a community-based pharmaceutical care service for employees with diabetes. So let's say in that health screening, we identify, a certain percentage of the employees have diabetes because they have elevated blood sugar. Diabetes can be complex to control, especially for people that don't have medical knowledge. And so the intervention in that case would be diabetes education with long-term follow-up with pharmacists to make sure that the patients are refilling the medications and taking their medications as prescribed. And the drug therapy management then is also coordinated with the primary care physician. So it's, again, there's this team-based effort going on here. And then the evaluation would look at a cost-benefit analysis of this program for the employees with diabetes and whether the employee's health status improved. So is it worth the money? And generally what we see in these kinds of things is it is worth the money spent. Diabetes especially can be really expensive, and screening and early intervention to prevent the condition from worsening and having a lot of the undesired side effects, consequences, because there's risk of stroke, cardiovascular disease, and so many things, renal failure, all of these things that can greatly increase their cost of care. So what are the differences between population health, public health, which we looked at public health in chapter 4, and community health? So you hear all these terms, maybe is it all the same thing? What's going on here? So first of all, their goals are all the same. So that's why a lot of times it can, they tend to be used interchangeably, but they're not really the same thing. So their goal is to protect and enhance the health of individuals or of a group of individuals. The term public health is often used when individuals work in the public sector, so the government. So public health usually has a government component. So like what the CDC does to educate, even though we're educating the population about diseases and prevention, is public health because it's funded by the government. Okay. Health workers who work in a healthcare system often use the term population health. They have usually an outcome-driven approach for a defined group of individuals who have a certain disease. And so that's the population, the people with that disease that they're trying to increase the health of. And population health workers then have partnerships with healthcare systems but also agencies and community organizations, and focus then specifically on health outcomes in those designated communities. And so things that can go on is like healthcare systems using like telehealth integration, but also claims and benefit management and clinical integration with some analytics to see if this is being effective, with care management, care coordination, reporting and measuring all of these metrics, and engaging the patients. And so these again may require partnerships with different entities in the community or different businesses, or but all of that together, again, we're doing it. Population health is a designated community, and we're tracking the health outcomes and then doing an intervention. Community health then focuses on efforts of organizations that promote health that is defined by either geography or culture. So community health workers usually use evidence-based strategies to engage those targeted groups, and often they go to where those targeted groups are. Many community health activities originate within a community by the members themselves. So I put here an example in this photo of something we have at one of our partner institutions. So we partnered with NYIT to have a program, a Doctor of Osteopathy program on our campus, and they have the Delta Caravan, and they will take it to in the Delta region to access communities that need care. So they have a lot of different programs that they do with this Delta Caravan. And so let's look at the CDC HI-5 interventions. So the CDC identified 20 issues in the community. This initiative is a non-clinical approach to population health to improve health impacts over 5 years. So that's what the HI is, health impacts 5 years. Okay. By addressing the social determinants of health. So, for example, in North Carolina, 2 workplace programs called Work Well and Mountain Wise address obesity, diabetes, and stroke prevention by providing opportunities to exercise and eat healthy. Again, the key being opportunities, and then of course these are lifestyle things, so these are things that people can choose, right? This is a non-clinical community approach to improve health outcomes. And so here is, a graph from the HI-5. I got it off the website. And so we have at the base, with the social determinants of health, things that can be done are water fluoridation, earned income tax credits, home improvement, loan and grants, public transportation system, developing that so people can get around, having clean diesel bus fleets, and early childhood education. So those are at the foundation and the social determinants of health, and then helping change the context, making the healthy choice the easy choice, because often it is a harder or more expensive choice. So in that part, we have multi-component worksite obesity prevention, pricing strategies for alcohol products, access to clean syringes, tobacco control interventions, motorcycle injury prevention, safe routes to school, school-based violence prevention, and school-based programs to increase physical activity. And so that gives you an idea of what is going on with the HI-5 program. And I believe that is the last slide. And so I have more on population health in video 2 coming up.